Let's wait just a few minutes and then we can get started. See if there's anyone else that's going to be joining us. All right, it's 11 o'clock and I think we'll get started. We are here from Comagine Health to do this webinar today. My name is Shannon Finegood. I'm the Senior Improvement Advisor for the state of Washington, and I'll be doing this webinar with my colleague, Tabitha Peterson. She's the Improvement Advisor from Nevada, and we're happy that you're here today. We just wanted to provide a couple more vaccine resources that maybe aren't on everybody's radar. So we were hoping to just spend a little bit of time and highlight those, and hopefully those help you in addressing some of your patients or staff vaccine hesitancy. So next slide, please. Comagine Health is a national nonprofit healthcare consulting firm. We work collaboratively with patients, providers, payers, and other stakeholders to reimagine, redesign, and implement sustainable improvements in the healthcare system. We're a quality innovation network quality improvement organization, and we receive federal funding from CMS to carry out healthcare quality improvement activities surrounding in part diabetes, hypertension, immunizations, readmission rates, and behavioral health. Next slide, please. We're leading the Partnership to Reimagine Healthcare, a CMS-funded initiative. As a healthcare provider stakeholder, quality improvement skills apply to all your efforts, from meeting Medicare to other measures to improving patient outcomes, to increasing your ratings and reimbursements. We can help you achieve these goals and more. Next slide, please. I'm going to pass this over to my colleague, Tabitha. Good morning, or good afternoon, I guess, depending on where you're at. So the CDC, this is our first resource we're going to share with you guys. The CDC, which I hope everyone knows about, but they have an emergency preparedness resource program that's designed specifically for clinicians, and it's called COCA, and that stands for Clinician Outreach and Community Activity. And you'll find a link in the chat of their main webpage. And if you scroll down about halfway, you'll find their newsletter sign up on the left side. And so that's the first link. And if you sign up, you receive announcements for their upcoming calls, as well as publications and other resources that they post on their web pages. And we find it really relevant and helpful information. Last week, they hosted a call that Shannon and I will review shortly for you in a minute, but they hosted a call and posted also an updated list of underlying medical conditions associated with higher risk for severe COVID-19. And so that's the second link you'll see on that slide and then in the chat. And we're bringing this to your attention because not only is it helpful as healthcare professionals to really understand when a patient might have severe complications and what to look out for, but it may be a useful tool in talking to some of your patients or residents that are hesitant to receive the vaccine or booster, right? If you look on that list and they have one or two or three of these conditions, it might be something that could change their mind in terms of, getting that immunization and that protection. Next slide, Ashley. So this, as I mentioned last Thursday, is the COCA call that we were talking about. So they hosted a call where they reviewed a number of important updates regarding guidance for clinicians on the vaccines. And so Shannon's going to give you a quick snapshot of some of the content, and you can find the entire slide deck in that second link, and then a recording of the call as well in both those links that are in the chat and on the slide. So next slide. So during that call, they had some really great graphics to help explain how their new wording applies to the vaccine. So what they were saying now is that your primary doses, if you are moderately or severely immunocompromised,
are the 3 shots and your booster is the 4th shot. And so they just wanted to clarify because now they're talking about being vaccinated versus being up to date with your vaccines. So being up to date would include that booster dose if you've had your primary series, and your primary series does not just include the 2 doses, it includes all 3. Next slide, please. And they had a really nice graphic here where you could see the timing of the doses, which I just found really helpful. So like with Pfizer, you are going to get your 3-dose primary series, and then 3 months later, you're going to get your booster dose, which would be your 4th dose now. And the same thing for Moderna, 3 months after your 3rd dose, and your 2nd and 3rd doses are a little bit more spaced out than with the Pfizer. And then if you've had Janssen, you'd want to have 2 doses, and then your booster would be a 3rd dose 2 months after. So they kind of gave a really good update during this call, and their slides are very informative for this. And this was the most recent update as of February 22nd. Next slide, please. Oh.
So this is our other resource we wanted to share. So the American College of Physicians has a web page, which I'll have Ashley go to in just a second, but it's a great resource that we recommend you spend a little time looking at. So they have a YouTube channel with several series of helpful videos. And so the links that you see on the slide are in chat. And Ashley, can you just pull up the site for us right now? Thank you. So they have 3 series of videos highlighted on the page. The first is called Ask Your Internist, where that's that first kind of line that you see there, where the videos are directed to lay people, patients really. So they spend a few minutes in each video, and they have them in multiple languages, where they're answering common questions that doctors are receiving right now, and they're specific to COVID-19. We're going to watch a clip of one in a second. But first, I wanted to show you the rest of the web page. So if we scroll down a little bit, you'll see that there's also the physician-to-physician conversations. And those are really where they share best practices on various topics, such as how to address miscommunication or misinformation with patients. And so those are where physicians are trying to kind of share with other physicians, the best way to handle certain issues. And then the last series that you see there, there are more, sorry, but the third one, sorry, thank you. The 3 I wanted to highlight. So the third one is the internists take care of yourselves too. And so this is where they're focusing on reducing physician burnout. And this may be a good link to share with any of the providers in your facilities. They talk about self-care, how to deal with anger, how to, ask for emotional support. So it might be helpful for folks working in your facilities. So Ashley, could you scroll back up to or actually, let's just play that one video we were talking about. So there's a video that is called, How Do We Know COVID-19 Vaccines Are Safe? And so we felt like this would be a good one to watch a minute or so of, because what we've been hearing from nursing homes and other facilities is that, this is a question that's coming up a lot. I don't trust this. How did this happen so quickly? And so he does a great job of explaining this in like a minute and a half. This whole video is about 3 minutes, and he answers some more great questions too, but we're just going to watch like the first minute and a half of it.
Hi, I'm Dr. Keith C. Ferdinand, and welcome to ACP's Ask Your Internist, where we answer your questions about vaccines. I can understand anyone who's concerned about the vaccines. I was concerned myself, but after examining the data and seeing the thousands of persons who were entered into clinical trial and were protected against hospitalization and death, I personally became convinced that these vaccines against COVID-19 are our best way to end this pandemic. Vaccines in general are placed on a backbone of good science. First, we tested in laboratory animals to see if it protects against an infection. Then once we've shown that it's been safe in animal models, we'll have human volunteers who will get the vaccine versus those others who will get placebo. We watch for effectiveness and for complications or side effects. Only after thousands of persons have been tested, and this is done with all vaccines, will it be released to the general public. I can understand anyone who's concerned with how fast the vaccines appear to be developed. Why do I say appear? What we have done with the COVID-19 vaccination has been a marvel of medicine, but it wasn't really done quickly or rushed. The platforms on which the vaccines have been built were worked on for many years by many scientists around the world.
Thank you. So it's a really just concise way of answering some common and seemingly complicated questions. And so there's a series of videos that are similar to that that could potentially help address some of these questions that are coming up from patients in nursing homes and post-acute care facilities. So that's the American College of Physicians YouTube page. Next slide.
Okay, the Agency for Healthcare Research and Quality had a really great series to address some of the cultural issues that people might be having, whether it's staff or patients. And I really thought that they were super helpful. They have a series of 8 videos. Can you open that up, Ashley? And then can you scroll down? Oh, see, they have videos to address each type of situation you might come in contact with. And they really word things in a way I feel like many different people could understand. And so we were going to play the last one, which was, I feel like kind of does a good synopsis of the whole message. And Ashley, could you play that?
All right, here's the last one. Our perceptions and the motivation of the messenger matter, as do our own motivations. So as we're looking at things like making the vaccine mandatory for your staff or providing incentives, really talking about why you're doing that, creating, even when you think your why is so obvious, repeating it and repeating it and repeating it and making it a habit to do it all the time, including because at the end of every sentence is really powerful. And doing that can really help to build trust, especially if you are looking at providing incentives or making the vaccine mandatory. It's also true that when people are feeling fearful, they're highly motivated to seek information. And so I love the example of asking people to share particular concerns and being willing to sit down with them to address them, to really understand what's important to individuals as a way of building trust. So learn about the motivations of the community that you're working with and some of their information seeking behavior, and get into the habit of being really transparent about your motivations always, even when you think that they are completely obvious.
So I thought that video or that message was really great because I think sometimes, maybe if you're the infection preventionist or, the director of nursing, you really think, okay, it makes total sense to me why everybody would want this vaccination. But then you go and you're talking to people and, you're so busy trying to, hype it up and everything that you don't always hear what their concerns are. So I just thought that was their whole series is great on reminding us all to stop and listen to people, listen to their reasoning and have a conversation, that one-on-one conversation so that you can help to reach them a little bit better. Next slide, please. Oh, sorry. Go ahead.
No, that's great. I was actually just gonna see if any, I know we have a few folks on here from facilities, nursing homes and rehab facilities. And so we were just wondering, what comments or questions you guys might have about really anything related to the vaccine. We will do our best to help point you in the right direction. But then also, we wanted to know what resources you all have found helpful while going through all of this the last couple of years. What's sort of a place that you go to frequently, if it's a website or you know, a person or really, you know, even a book you crack open or whatever it is. But what resources have you guys found helpful to help educate you on what's going on, but also kind of just guide you through this, I was going to say transition, but it's a really long transition, pandemic? What are some thoughts folks have, or what are questions or resources you want to share? You can put them in the chat if you like, or we'd love to see your beautiful faces if you want to turn your cameras on and talk through the mic. If you're on the phone, feel free to just hit *6 and unmute yourself.
So Barbara put in that her resources have been the KITSEP, hopefully I said that correctly, Public Health Department, the CDC, and the World Health Organization.
KITSEP, what is that? I don't know that one.
That's in Washington.
Okay.
Kitsap County.
Oh, awesome. That's great.
Yeah, the counties usually do a pretty great job at updating everything pretty regularly. And then did you find, Barbara, that that some of these messages for addressing different cultural issues or misinformation were helpful at all? Or did anybody that is listening in?
We don't have anything. Oh, Barbara just responded. Yes and no. Excuse me. I have one resident who will watch videos related to the vaccine and think about it, but she doesn't change her mind.
Mm.
Oh yeah, we've definitely heard a lot of that.
Well, I mean, I do think it's something that she's still willing to watch videos and listen to you and, you know, try to learn from you. So I wonder if maybe one of these days she'll surprise you.
It definitely can happen.
Tip, did you have anything you want to share, any resources that you use that are helpful?
I use the same ones.
Okay.
And I don't think I have any misconceptions or anything, have gotten any. I sort of have an idea when I go on and ask, and so it's more of a clarification, especially when things change all the time.
Yeah, that's for sure.
Just really re-verifying everything that I hear.
Yeah, smart. That's smart. Yeah, I found yesterday I was looking for something specific that I had heard, and I was trying to verify it on the CDC website, and it was rabbit hole between, I found it, but then I was also curious about other things I was reading, and it's just like you could spend hours on the CDC website just learning about updated things. So definitely keeps you busy. But we're always here too if you guys don't have time to weed through all the extra stuff, right? And you just need to find the source of the information, you know, let us help weed through that. If you've heard something and you need to verify it, you know, just let your state lead know or someone that you've worked with. We can find that for you so you don't have to do that.
Yeah, feel free to email us.
Barbara chatted in that it is something that the residents have said to her, and why should I get the vaccine now when the pandemic is almost over?
That is a very good question. So some of those videos address how to talk to them, especially those Ask the Internist about why a booster is so important, or even the primary series. So I suggest, you know, if you watch any of those, or you could show one to them, or you can talk to them about, you know, how they are keeping the pandemic away by getting the boosters, that it didn't just come and go. So, you know, it depends on the person always. It always depends on their personality. But I would suggest maybe maybe they would respect it coming from the internist, from the doctor, you know, so maybe showing them a video like that might be really helpful.
There's also, I'd have to go back and look, but you know, and you mentioned this, Barbara, but I feel like I've seen videos on Instagram from the World Health Organization where they're essentially talking about the pandemic's not over, right? And we're still doing this. And the reason we're still doing this is because not enough people are vaccinated. And as soon as we get enough people vaccinated, you know, that's when we're going to see this start to kind of come to a close. And so I believe it was WHO that I saw some materials on that, but I can look. They have some good social media posts actually, but let me look and see, and then we can send that your way if you think that might be helpful.
She said, I like that suggestion.
Okay, yeah. Let me see what I can find from their social media.
I remember seeing one, I can't remember which of our video series that we were looking into. There was one where they were talking about, you know, how by getting your booster, you know, you're preventing the mutations and all of that type of thing too. And by getting vaccinated, there was a really good one that explained that really well. So maybe we can find that too and send that out. I'll look around. It was in one of
think
those.
it was that Ask Your Internist.
I know, I remember.
I think it was because we were debating of whether to show that one or not. Now I'm thinking we should have showed that one.
Yeah, yeah, it was really good talking about, you know, why you need to do this and how we're going to prevent mutations and things like that. It was really well done. So that might be a good one for us to send out to you.
Any other kind of common questions you guys get from your residents that are hard to answer?
Carolyn typed in, do you think there's confusion about the definition of herd immunity? Some people seem to think that not getting the vaccine is what herd immunity is.
Oh man, I haven't heard that yet.
Yeah, that's a really good question. I feel like we could definitely find something. I mean, I could see how people would be confused about herd immunity, and especially because some of the wording I feel like that I've seen lately has said, you know, that we might not reach herd immunity and all these different things. So there's probably, if you know, are reading around, you can find lots of different messaging. So maybe we can find something and send that out as well. So that way it can give a little bit clearer message.
I'm also going to enter into the chat the video that on the Ask Your Internist page, the specific video that is titled, Why Do We Need COVID-19 Boosters? And it's a physician that talks about, he's an infectious disease specialist, and he talks about just what Shannon was mentioning earlier around, you know, the importance of getting the booster and why that is going to help eliminate or help minimize mutations of the virus and hopefully potentially end the pandemic. Barbara, you're able to access, well, yeah, because she's been sending stuff through chat, so she can see that link. Any other questions or comments? Yeah, go ahead, Donna.
Barbara just chatted in. I think that people misunderstand herd immunity. They seem to believe that if everyone around them gets the vaccine, that it doesn't matter if they get the vaccine.
Well, that's not wrong, but but everyone can't think that.
Yeah, right? I mean, if everybody thought that way, then nobody would be vaccinated. I see what they're thinking, that they're protected by their herd around them, yeah. But yeah,
we need enough people in the herd portion of the group.
Exactly. So yeah, I could see where they're coming from, but maybe there's another way besides the herd immunity route to help them understand why it's important to get a vaccine, you know. So if they're, I mean, I guess, you know, you can validate, yes, if everybody around you is vaccinated, you're much less likely to get it. But here's some reasons why we think you should still get it that maybe aren't related to herd immunity, but are related to other things. You know, you have several comorbidities. So if you did happen to get it, then you have a higher likelihood of ending up in the hospital compared to even your neighbor who has much less comorbidities. So, you know, and it could be, you know, a visitor comes in and they bring it. So even though, and they're not vaccinated or something. So it's just, you know, there's definitely many reasons to get vaccinated. So usually if somebody's got kind of a stop right there, kind of an attitude about one aspect of it, it seems like it's good to kind of go in a whole different route.
Yeah, Barbara shared that she disagrees with herd immunity. She said, I've used that exact contention, and they still do not want the vaccination. So, you know, the challenges that we all continue to face, right?
It is like people can just keep coming up with stuff. And sometimes too, I found, you know, that people just don't want to get it for, you know, they just don't want to. So they'll keep coming up with reasons. But one thing that I found in the skilled nursing facility was that, you know, even people that didn't want it, sometimes it was really helpful to just say, you know, if we're going to do a group activity, you have to be vaccinated. And then they'd be like, okay, well, I guess I'll just do it because I want to go to coffee chat or whatever. So that was one other thing that sometimes they're like, yeah, I really just don't want to get it for all the reasons, but I'd like to go to this activity. So I'll just get it for that.
Lisa shared that COVID will continue to be in the community after the pandemic and has the potential for outbreaks similar to the flu. Therefore, the need to get a vaccine is still relevant since the risk is still there.
Just like measles.
Absolutely. Absolutely. Ashley, do you mind pulling up the evaluation poll for us? Folks can certainly share comments or questions. But when you have an opportunity, right here is the evaluation for today's session, and we really appreciate your thoughts. It helps us guide the content and the conversation for the next meetings that we have with you. And this is our contact us page where you can see who is the state lead in your state. And we also have Lisa, who's on the call, and she's the state lead for Oregon, but she's also our NHSN expert. So if you have questions about NHSN, you can just contact her directly if you like.
And we're always happy to answer any questions or connect you with any resources that, you know, can answer your questions in more detail if you need as well. So sometimes it's good to just ask us if you don't want to have to spend that extra time, you know, looking around. We are happy to do that for you.
Any other final comments or questions? We really appreciate your time today.
Barbara chatted in, I just finished watching a great course on the Black Death. Hopefully COVID won't be as prevalent or last as long as the plague did. However, the COVID virus keeps mutating.
Yes, we all hope that too. Definitely, definitely. We really appreciate you guys joining us today. I hope that our information has helped you in our continuing battle to fight this pandemic.
Thanks for sharing, everybody.
Thank you.